Hi pelvic health practitioner, welcome to Embodia. My name is Natalia, and in this video I will give you a brief tour of pelvic health content on Embodia. Embodia is your one platform for pelvic health, online continuing education, exercise prescription, patient education, and questionnaires, including the Bladder Diary and Fibre Diary, which can be shared digitally with patients via web and mobile apps. Continuing education leads to improved care and improved patient outcomes. We offer hundreds of on-demand and live courses from top pelvic health educators that you can take on your own time and at your own pace. We also offer courses across every area of practice, including neuro, orthopedics, pain science, pediatrics, and more. But in this video, we will focus on the pelvic health content and features most relevant to you, the pelvic health practitioner. We offer thousands of high-definition, diverse and inclusive exercise videos with voiceovers and print-friendly options. There's a large library of pelvic health-specific exercises that you can easily share with your patients, provide custom instructions, monitor progress, and directly message patients, all on Embodia's secure platform. We also offer a wide range of shareable pelvic health education for your patients. If you prefer to create your own library of exercises or education, you can easily do that on Embodia. If you're connected to a clinic on Embodia, you can develop a clinic library of content that you and your colleagues can use. You can also create and customize questionnaires, including intake forms, satisfaction surveys, and standardized outcome measures. Embodia will tally the scores for you and track change over time. Quickly and easily share bladder or fibre diary with your patients. You can then complete them from any device. Not many people want to bring a piece of paper with them to the bathroom, but most people bring their phones. Patients can add unlimited entries, and practitioners can view, monitor, and print entries from simple dashboards. Each patient has their own unique and secure credentials to log in from any device. Patients can access their programs and track progress from the Embodia website or mobile app. Practitioners can also access Embodia from any device. Using the mobile app, practitioners can easily prescribe exercises or education on the go. Share bladder or fibre diary, or record patients doing exercises. Patients always use Embodia for free, and practitioners pay a monthly or annual membership fee. All of the features we've covered here are included in Embodia's Tier 2 membership. You can sign up by logging into your account on the web version of Embodia. Head over to the top right corner and then to My Membership. Select the Tier 2 membership, or if you're looking for the ability to chart, schedule, bill, and online book, as well as all of the features shown in this video, select the Tier 3 membership. If you have any questions, please book a free demo to learn more, or reach out to us at support@embodiaapp.com.